After $6 million and 4 years of construction, the Bonavista Peninsula Health Center has a new emergency room.
The state-of-the-art equipment in the area, 7 new treatment areas. There's spaces whereby we can speak to patients in a closed office area if that needs be. There's an area there for collaboration of the team. So the flow, it's very bright. It's just beautiful. So it's the way a true emerge is supposed to be situated, right? It brings it right up to standard, and it's one of the best ER rooms that we have now in our zone.
A small crowd of politicians, staff, and others were there for the official opening this morning.
Been involved with the health committee here for a number of years, and we have long been working with the government, with the health authority management on required improvements. The new ER department here is it's something that we've been looking for and working on for quite some time. So we're thrilled, and we're thrilled what it means for the community, for the region, for the health services that are offered here, and for the recruitment and retention of more health professionals, of course.
The opening comes as the health department struggles with keeping rural health centers open. Gaps in staffing have forced them to close emergency services here. In recent months, however, services have been more consistent.
Our staffing complement is very much, I guess, in progress, because we are recruiting every day. We have the ability to have 5 physicians here, and I think currently right now there are 3 recruited with more recruitment ongoing from a physician point of view. And from a nursing point of view, the nursing resources in this site are fairly stable, and anything that is vacant we're recruiting every day to make sure that we continue that stability.
Meanwhile, the town itself is taking an active role in dealing with the health care crisis by offering incentives to medical professionals who move to town.
We have, step by step, working with the health authority, had new contracts signed for ER and family practice physicians coming in. We're also working on nursing recruitment. We're still working on ongoing physician recruitment.
There's days there's challenges, and then sometimes we rely on locum physicians to help support and augment those gaps. But we certainly have been able to sustain services with the current resources we have for the last several months, and we haven't had any gaps in services over the last 3 months that I'm aware of, periodic, very small, which at times we then turn to virtual options or nurse practitioner options to keep our emergency stable here in this facility.
What's next for the health center here? Well, the health authority wouldn't get into specifics, but it did say they are in constant communication with local staff and are working on priorities to keep improvements coming. Troy Turner, CBC News, Bonavista.